Hi folks, thank you for visiting the live session here. And I just want to go through the poster a little bit here. If you see, wounds are a major problem in healthcare, and there are multiple kinds of wounds: arterial, venous, surgical, traumatic, and diabetic. Most of the wounds don't have much standardized care delivery model, except the real standard is debridement, exudate management, and infection control. When that is done, what is other things that have to be in place are very important, which is pressure offloading, and the real major one that is not given more attention to is nutrition. So the nutrition that is mostly given in wound care is complicated, given that patients are diabetic, they have metabolic dysfunction with underlying insulin resistance and glucose toxicity. What is happening with traditional approaches is when you're given a regular drink that is protein, quote unquote, supplement, that there is glucotoxicity that exacerbates metabolic issues and prevents healing. And that's a huge problem when there is insulin resistance, which most patients have. And in our clinic, we were doing regular treatments, and we found that when we improved the patient's nutrition, it helped. So it is hard to track these and guide the patient. So what happens is, what we decided is, we bought in a platform and we started giving the platform to the patient. This platform involves blood glucose and also food logging and wound tracking. So basically, when I'm able to use the platform, there is more engagement when I see the patient. Say, I sit and counsel the patient one time for 40 minutes, give them a handout, and then follow up at every time, and during the follow-up, when I'm doing the debridement procedure or something, we talk about what they're going, and then I'm able to look at the scale. My assistant is able to tell me what their sugar is, and they look at the picture. So that is the standard process that we followed with a remote patient monitoring platform-based solution that is integrating all the different aspects of patient-centric and provider-driven platform solution. Here, as we did it, we tracked the number of patients, but it was we just took a name and medical record number, that's all. Nothing much was given. I said, okay, we are seeing positive outcomes. So I said, let me go back and review. And I gave them names of people that I had collected over 1.5 to 2 years, I think. And they reviewed the charts. We found out that we have 29 patients who had received nutritional guidance. And of those 29 patients, 11 were diabetic, 4 were venous, 4 were arterial, 7 post-surgical, 2 were traumatic. So we tried to compare them, but given that they are different etiologies, we are not able to compare different etiologies. So most of the wounds that have standard of care delivery included diabetic ulcers only, mostly. Other ulcers, they follow rest of their standards, but different location, different processes is the problem, whereas with the diabetic foot ulcers, it's more easier. So the key in diabetic foot ulcers, one has to understand, is the wound has to heal 50% in 4 weeks for it to go on to heal in 12 weeks completely. This was a study done by Dr. Peter Sheehan, and that is a standard that is being followed in wound care delivery mostly. So in these patients, of 11 patients, then we took those 11 patients and looked at their compliance. Compliance, like are they posting pictures? Are they coming to the visits? Are they taking blood glucose? Are they following through? So in those 11 patients, basically in patients who were, we put them on a trend line and found out that people who were on the bottom of the trend line were doing better, and also in the fully compliant patients, they went on to heal within 9 weeks. Partially compliant patient, on the average, they went on to heal within 13 weeks. And also, as we were doing that, we looked at the waist circumference of the patient. The waist circumference in people who were compliant reduced, But as you take the waist circumference, we have to understand that most of the waist circumference is manually taken, so there is error. And also you have to understand that waist circumference, really the best way to do it is in a lying position, which would not be done in a busy clinic. So, as we are doing also, we looked at medication compliance. So, of those patients, at least 2 of them did not have all the medications taken out. So diabetic medications were reduced, and a lot of them had reduction of their medication doses, say from 60 to 20 units of insulin or something like that. So we have to understand that average healing time, patients' adherence to therapeutic restriction of carbohydrates with high protein helps wound healing, and there is reduction in BMI, weight, and waist circumference improvement, and high level of nutritional compliance were strongly associated with healing time. So we have to understand that with this significant approach, low-carb, high-protein diet as a nutritional approach to enhance wound healing is a huge aspect that has to be more standardized and approached in diabetic wound care. And also, the best in real-world setting, this is a real-world study, and we did do insulin, we did do NMR lipid profiles initially, but we could not compare HOMA-IR and all that, but over time I see their improvement. But in a completed, in a real study, hopefully we will in the future repeat those lab parameters and biometrics, and also work on the platform-based solution. Hopefully we'll get more data, and we need to do more studies. But please, I have this posted on social media. I will have more links, and the poster will be there, and the links will be there on the poster. This will give you the explanation of the data. This one for the whole poster, and basically when you have this one, this link will give you how 10% weight loss will help with improvement of ulcers, for different ulcers, and this one will give you the list of video presentations that I have. So these video presentations have I think 7 or 8 of these patients that we took, but what I plan to do is over time I will add all the 29 patients to this list, and then another thing that we are doing is a survey wherein we are surveying all these 29 patients whose data is being analyzed here. And once the survey comes back, we'll also publish the results of that survey. And please reach out to me, and please understand that metabolic health matters in disease outcomes, particularly chronic diseases, and diabetic foot. People are suffering, and I think communication is a real problem in healthcare delivery. We can talk psychology and all that, but communication where patient sees this foot caused this response, maybe I should change that, and then guided health coaching will be easily implementable with that. So thank you very much, and hopefully this will be the impactful start for wound care and real nutritional approach that is targeting insulin toxicity improvement rather than carb loading solutions. So thank you very much.